Hello guys, this is Dr. T. Welcome to Clinical Medicine with Dr. T. So guys, I want us to continue with our talk on ARVs. I know that when it comes to ARVs, students and interns, I think that's one topic that we don't like. But the sad thing is that we meet patients with who are on treatment, who are infected with HIV. And we are going to become servs soon and be medical officers. And I think to leave internship and be a comserve without fully understanding ARVs and the regimen that are out there and the protocols would just be ignorance. So let's do this, guys. We started with PMTCT, which we are done with it now. So this is a building block to talk into adult antiretrovirals. And as I was thinking about this topic, I felt that talking about the drugs would not do this topic justice, because we need to understand first the immunity, just basics, not anything hectic, and also to understand the virus. So in this part, I want us to talk about the immune system, just briefly. I think we're going to talk about the immune system more when you talk about vaccines and the types of vaccines that are out there and why do we really need to be vaccinated. I'm not even talking about COVID now, just general vaccination. Why is it important? Because the immune system, the innate, the acquired, things like that. Yeah. So here we're going to talk about basic immunology, because we are building up to talking about the HIV virus, what it does to the body, and the drugs that are given, where they work, and that kind of a thing. So basic immunology, and what I'm going to focus on is mainly hematopoiesis. Okay, there's no way we can talk about antiretrovirals without talking about the immune system, because the HIV pathology is centered around the immune system. Yes, there are other manifestations now of the virus, like CNS manifestations, skin manifestations, that type of a thing, but everything starts here. So as we all know, poiesis means to produce or to make, and heme means blood. So this is essentially production of blood cells, and this all happens in the bone marrow. That's our bone. If we make a cross section of this bone, it's gonna look like this. And that's the cortex, and inside that cortex we're going to have marrow. That's where everything happens. In that marrow there are stem cells called the hematopoietic cells, or the hematopoietic stem cells. Hematopoietic stem cells. as we all know that stem cells are your kidney cells. They've not decided whether they want to become male or female. Those are stem cells. So you can take a stem cell and make any cell out of a stem cell. You can make a nail, you can make a hair, you can make a cardiac cell, you can make anything out of a stem cell. So those are the cells that are found there. When I think about stem cells, I think about that kid who is brought up in a supportive family, and his or her dreams, or their dreams, let me say their dreams, are encouraged. They're encouraged to dream. Look, you can be anything you want to be in the world. The world is yours. Go out there and be what you want. And then this stem cell gets excited because there's motivation around that you can be anything that you want. So this stem cell can take two paths. Can take the path of a common myeloid progenitor, or a common lymphoid progenitor route. So there's a bit of a commitment now. This excited kid of ours has decided to become, okay, I want to become a myeloid. But when it becomes a myeloid, you still need to decide, if you become myeloid, do you want to be a megakaryocyte? A megakaryocyte, so that later on you become a thrombocyte. Or do you want to be an erythroblast? From being a myeloid, do you want to be an erythroblast, so that later on you become an erythrocyte? Now the kid needs to decide. The kid needs to decide now. Maybe the kid say, no, I actually want to be a myeloblast. So if you get to the myeloblast stage, you can either become one of the granulocyte cells, granulocyte, and those are basophils, eosinophils, and neutrophils. Right? So basophils, eosinophils, neutrophils. So there are so many steps that are involved here, but we are not focusing on the steps now. We're getting from the primary to the last step, thrombocyte. The other cell is a monocyte. In monocytes, later on they become dendritic cells and that kind of a thing. And if you come this side, this one is going to become a From there, can become, I don't know how to put this because I don't have space now. Can become, okay, let's do it this way. Can become a natural killer cell or a small lymph cell. That small lymph cell can later become a B lymphocyte or a T lymphocyte. Obviously, I'm leaving so many steps. That are involved here. So this is a T lymphocyte. I hope this will show. Natural killer cells, B lymphocyte, T lymphocytes. Now the question is, if this HIV virus attacks lymphocytes, which lymphocytes does it attack? Okay, we know it's the T lymphocyte, but why is it not attacking the other cells? And also, if only the T lymphocyte is attacked, why do patients end up still dying from opportunistic infections, whereas these guys are still there? What happens to these guys, your neutrophils, mainly your neutrophils? What happens to neutrophils that makes a person to die from an infection that a neutrophil can actually deal with? You still lose a patient from that. And what makes the T lymphocyte special, that it gets attacked by the HIV virus? Why not the B? Why not the natural killer cells? Why not your granulocytes? Why not even your monocytes? Remember, monocytes later become macrophages, right? Yeah, they later become macrophages. So this is what I wanted you guys to understand, that now when we're going to be talking specifically and deep about the T lymphocytes, where do lymphocytes fit in the entire picture? Because this HIV virus, it deals or destroys the immune system of a patient or of the infected person, and it doesn't really do anything when it comes to the other cells mainly, but it targets the T lymphocytes. We are going to talk about which type of a T lymphocyte, but why do these cells also end up not being effective as well? That's what we're going to be talking about. So let's meet in part 2 of this. Thank you guys.